Hello and welcome. This is Jill bringing you a new episode of the Homoeopathic Compendium podcast series. In each podcast you can listen to a short reading taken from the 6 volumes of the Homoeopathic Compendium by David Little. The selected topics are designed to be interesting, informative and thought-provoking. Each one is just a brief glimpse of important themes that are discussed at much greater length in the compendium. To all our listeners, whether you are a student, a home prescriber, or an experienced professional, we hope you enjoy these readings and find new ideas and inspiration for your practice of homeopathy.
The Hippocratic Tradition formed the background of Samuel Hahnemann's medical view. One finds occasional references to the classic temperaments in Hahnemann's casebooks, the Materia, Medica, Pura, and the chronic diseases. This 2,500-year-old tradition was preserved in homeopathy because knowledge of classical temperament was taken for granted by the first generation of homeopaths. It is time to recover these lost gems and return the science of physiognomy to its rightful role in the healing arts.
This is Compendium Talks Episode 10, Constitution and Temperament in Hahnemann's Writings. The reading is from Volume 5, Chapter 1, Constitutional Medicine. Temperaments in the Materia Medica Pura. Hahnemann first mentioned the role of temperament in homeopathy in his lecture on pulsatilla in the Materia Medica Pura. In this discourse, the founder spoke of how the intellectual and emotional aberrations of the patient are just as important as the physical symptoms. For this reason, the best remedy is one that fits the corporeal symptoms of the disease as well as the mental symptoms of the patient. This is a groundbreaking maxim that makes homeopathy different from any other medical system. No other materia medica emphasizes the mind and body in an equal manner or records the psychology of remedies and patients in such detail. Hahnemann wrote, "The homeopathic employment of this, as of all other medicines, is most suitable when not only the corporeal affections of the medicine correspond in similarity to the corporeal symptoms of the disease, but also when the mental and emotional alterations peculiar to the drug encounter similar states in the disease to be cured, or at least in the temperament of the subject of treatment." In aphorism 212 of the Organon, Hahnemann stated a, quote, "chief ingredient of all diseases," unquote, are changes in the mental and emotional state of the patient. And at the same time, every medicine alters the mental and emotional state of the prover in characteristic ways. For this reason, he said in aphorism 213, one will never cure in accordance with nature unless one attends to the symptoms of the mental and emotional state, together with the other symptoms in every case of disease, unquote. He also notes that the innate temperament of the subject under treatment may be considered when selecting homeopathic remedies. In the following quote, Hahnemann refers directly to the teachings of Hippocrates on the phlegmatic temperament. He wrote, "Hence, the medicinal employment of pulsatilla will be all the more efficacious when, in affections for which this plant is suitable in respect to the corporeal symptoms, there is at the same time in the patient a timid, lachrymose disposition, with a tendency to inward grief and silent peevishness, or at all events, a mild and yielding disposition, especially when the patient in his normal state of health was good-tempered and mild, or even frivolous and good-humouredly waggish. It is, therefore, especially adapted for slow phlegmatic temperaments. On the other hand, it is but little suitable for persons who form their resolutions with rapidity and are quick in their movements, even though they may appear to be good-tempered." Unquote. The above portrait includes the psychological state of the patient in a time of health and happiness, as well as the changes brought on by the alterations of disease. There are some who say that one should pay no attention to natural temperament, heredity, or any positive states or mood, as they are not part of the presiding disease. They say such things are not included in homeopathy. They do not understand that Hahnemann introduced the rubrics well adapted to, which deal directly with diathesis, constitution, temperament and disposition in various materia medicas. His instructions in aphorism 5 ask the homeopath to assess the condition of the body and constitution, as well as the character of the intellect and emotional disposition as part of the attendant circumstances. In harmony with these ideas, the founder's portrait of Pulsatilla includes the qualities of the natural temperament, i.e. timid lachrymose disposition, slow phlegmatic temperament, the positive moods, i.e. good-tempered, mild, good-humouredly waggish, and negative emotions, i.e. inward grief, silent peevishness. After listing the qualities of the natural temperament and negative moods, Hahnemann says that Pulsatilla is useful especially when the patient's normal state is, quote, good-natured and mild, even frivolous and good-humouredly waggish, unquote. This portrait clearly shows the skillful use of natural temperamental states and positive moods in comparison with negative moods. This complete psychological assessment offers deep insights into the personality of the patient. Although happy moods are not a disease, they provide attendant circumstances related to character that might be helpful in selecting a remedy. This is because natural temperament contains both positive and negative dispositions that condition the way in which an individual expresses their mood swings. Once again, the complete portrait of the patient and their disease involves a healthy balance between cause, miasms, disease symptoms, and concomitant circumstances. Hahnemann wrote that Pulsatilla is well adapted for slow phlegmatic temperaments, but that it was less useful in those who form resolutions with rapidity and are quick in their movements. This usage of the term phlegmatic temperament implies much more than just an emotional mood or tone. The gentle, sentimental, empathic, sympathetic feeling tones of the phlegmatic temperament naturally come along with a moist, smooth, graceful constitution that moves in wave-like motions. Pulsatilla has some of the symptoms of the nervous temperament and may appear hysterical or impulsive at times. Nevertheless, it is much less indicated in the pure nervous type. During the formative years of the Materia Medica at Leipzig, 1818 to 1820, Hahnemann introduced the concept of using contradictory temperamental qualities to eliminate the incorrect remedies. These ideas were later introduced into the main body of the teachings in the note to aphorism 213, where Hahnemann wrote, "Thus, aconite will seldom or never produce either a rapid or permanent cure if the patient's emotional state is quiet and uniformly calm. Nux vomica will not cure if the patient has a mild and phlegmatic emotional state. Pulsatilla will not cure if the patient's emotional state is glad, cheerful, and stubborn. Ignatia will not cure if the patient's emotional state is unchangeable and not inclined to fright or vexation." Unquote. This forms the basis of elimination of the unsuitable remedy by constitutional and temperamental counterindications. Aconite is counterindicated in mild, placid temperaments because it is more suited to plethoric, full-blooded sanguine individuals. Nux vomica is counterindicated in mild, changeable individuals because it works best in the choleric rather than the phlegmatic type. Pulsatilla is not suitable for extroverted sanguine persons because it is better adapted to the tearful phlegmatic temperament. Pulsatilla is not very useful in persons who form resolutions rapidly and are quick in their movements. Lastly, Ignatia is not suitable for those who are of steady, even disposition, because it works better in extremely nervous temperaments with a hysterical nature and quirky symptoms. Hahnemann separated mental disorders in two major categories, the psychological and the organic. Psychosomatic disorders are based on psychological and ethical causes that affect the soul, spirit, intellect, head, sensorium, and emotional disposition, heart. Many of the organic mental disorders are caused by inherited and acquired miasms. Psychological counselling ameliorates the psychosomatic disorders, yet aggravates the organic mental diseases. That is why psychiatric therapy often fails in the mentally distressed patients without the aid of homeopathic remedies. Many mental disorders have a genetic basis, often related to inherited conditions and chronic miasms. These inherited dispositions affect the very makeup of the physical constitution and mental temperament. Temperaments in the chronic diseases. Hahnemann noted that the classical temperaments, like the physical constitution, conditioned the nature of the symptoms that were produced after the suppression of sora. For this reason, he included the observations of the experienced and honest Dr. Juncker in the main text of the chronic diseases. A brief survey of the manifold misfortunes resulting thence is given by the experienced and honest Ludwig Christian Juncker in his Dissertatio de Damno Excabiae Repulsa, published 1750, pages 15 to 18. He observed that with young people of a sanguine temperament, the suppression of itch is followed by phthisis, and with persons in general who are of a sanguine temperament, it is followed by piles, hemorrhoidal colic, and renal gravel. With persons of a sanguino-choleric temperament, by swellings of the inguinal glands, stiffening of the joints, and malignant ulcers, called in German Todenbruch. With fat persons by a suffocating catarrh and mucus consumption. Also by inflammatory fever, acute pleurisy, and inflammation of the lungs. He further states that in autopsies the lungs have been found indurated and full of cysts containing pus. Also, other indurations, swelling of the bones and ulcers, have been seen to follow the suppression of an eruption. Phlegmatic persons, in consequence of such suppressions, suffered chiefly from dropsy. The menses were delayed, and when the itch was driven away during their flow, they were changed into a monthly hemoptysis. Persons inclined to melancholy were sometimes made insane by such repression. If they were pregnant, the fetus was usually killed. Sometimes the suppression of the itch causes sterility. In nursing women, the milk is generally lacking. The menses disappear prematurely. In older women, the uterus becomes ulcerated, attended with deep burning pains, with wasting away, cancer of the womb." Unquote. This document shows that the suppression of a skin lesion causes a noticeably different syndrome in each of the 4 Hippocratic temperaments. It also demonstrates the fact that the innate constitution and temperament is the major conditioning factor in the development of the individual signs, performance, and symptoms. The second most important factor is the presiding physical and psychical environmental influences that directly affect the patient. For these reasons, the homeopath should pay special attention to the exciting, maintaining, and fundamental causes, unresolved miasms, and all the signs, performance, and symptoms, as well as accompanying circumstances. When one compares the statements made in the chronic diseases and the organon, it becomes obvious that Hahnemann considered that the innate constitution and hereditary disposition, as well as the environment, played a very important role in the development of the signs and symptoms of chronic disease. These conditioning factors are responsible for the great number of differing chronic diseases that may be produced by the miasms and suppression. No individual share exactly the same physical constitution or hereditary tendencies, nor do they have exactly the same upbringing, education, lifestyles, habits, customs, diet, occupation, mental temper, or ethics and morality. For these reasons, no two individuals suffer exactly the same characteristic symptoms, although they may share certain symptoms more common to the miasm. The information found in these passages is very similar to the data to be recorded during case-taking as expressed in Aphorism 5 of the Organon. Here Hahnemann suggests assessing the exciting causes of acute diseases, as well as the most significant factors in the entire history of a degenerative chronic disorder to find its fundamental cause, which usually rests on a miasm. In these investigations, the healing artist should take into account the condition of the physical body and constitution, especially when the disease is chronic, the character of the intellectual and emotional disposition, occupation, lifestyle and habits, domestic and social relationships, age, sexual function, etc. On the solid foundation of Aphorism 5, Aphorism 6 then goes on to collect the presiding objective signs, accidental or coincidental befallments, and objective symptoms of the body and soul felt by the patient, perceived by those around them, and observed by the healing artist. This data forms the only conceivable gestalt of the disease. The combination of the etiology, miasms, the significant factors of the medical history, and the attendant circumstances, Aphorism 5, as well as the totality of the presiding symptoms, Aphorism 6, offers a view of the essence of the disease state, which is the mistuning of the vital force, Aphorism 7. In Aphorism 7, Hahnemann states, in cases where there are no occasioning or maintaining causes, one can perceive nothing but the disease signs. Therefore, it is the symptoms alone that point to an appropriate remedy, along with regard for any contingent miasm and with attention to attendant circumstances. Aphorism 5. In Aphorism 18, Hahnemann says that there is nothing but the totality of the symptoms with consideration of the accompanying circumstances by which diseases show how they may be cured. Therefore, he opines that the complex of all the symptoms and circumstances are the only indicator, the only reference in choosing a remedy. The theme that the sole indicator of a remedy is the totality of the symptoms, Aphorism 6, and concomitant circumstances, Aphorism 5, is repeated in Aphorisms 7, 18, 24, 85, and 245. To understand the complete case, it is important to assess how the physical constitution and mental temperament of the patient interacts with their mental and physical environment. What is the condition of their body? What is their constitution like? What is their mental and emotional character like? What are the occupational factors or hazards? What is their lifestyle like? What are their customs and habits? What are their familial and social relationships like? What stage of life are they in, and how is the aging process affecting them? What is their sex and what is their sexuality like? What other circumstances are affecting the patient's life? These constitutional and environmental factors form the basis of the case history because they offer insights into who we are treating. Aphorism 5 provides information on the patient, while Aphorism 6 provides the data about the essential nature of the disease state. This balance of the patient and their disease makes up a complete case. On the basis of the causation, miasms, and concomitant circumstances, one then assesses the nature of the totality of the signs, performance, and symptoms. What is the nature of the main complaint? What are the locations, regions, systems, organs, and tissue that are affected? What sensations, feelings, and pains do they experience? What are the times and modalities that make them feel better or worse? What concomitant symptoms does the patient experience? One must ask them, where do they feel discomfort? What does this discomfort feel like? Are there any times, positions, or circumstances that affect this discomfort for better or worse? Are there any other complaints that come along with this discomfort? Are there any other complaints that seem to be independent of this discomfort? If so, what are the locations, sensations, and modifications of these concomitant symptoms? This investigation completes the circle of the totality of the symptoms and provides a deeper understanding of the attendant circumstances. There are some who say one must treat the patient, and others who say one must treat the disease. These individuals argue at great length about this dichotomy. One must treat the patient and not the disease. Oh no, one must treat the disease and not the patient. And round in circles it goes. Where it stops, nobody knows. Why? This is because these views express mutually opposite dualistic concepts, not the middle path of common sense. No one can separate the patient and their disease because they come together as a unity of experience. No patient, no disease. No disease, no patient. Why is this? The simple answer is the very definition of a patient is one who is suffering from a disease who consults a healing artist. If they did not suffer an illness, they would not need relief, nor would they see a healer. So they would not be patients. It is that simple. What Hahnemann is offering in aphorisms 5, 6, and 7 is a method of treating the patient and their disease as a unity in a practical manner. Aphorism 5 concentrates on the cause, miasms, former symptoms, and the concomitant circumstances affecting the patient, and aphorism 6 concentrates on the essential nature of the disease case at hand. Aphorism 7 unifies all these factors together in such a manner that the patient and the disease provide all the information necessary for finding the most appropriate remedy. That's the end of our reading for this episode of Compendium Talks. Thank you for listening. I hope you enjoyed it and found it interesting. Remember, look out for our next podcast. See you again soon. Bye-bye.